Welcome to another nursing review on pharmacology. This lesson will focus on aminoglycosides. We will first learn about the actions of this medication, adverse reactions, and contraindications. Aminoglycosides are typically used for infections such as septicemia, urinary tract infections to even Pseudomonas aeruginosa. Now let's discuss how it works. Aminoglycosides are bactericidal. They prevent the synthesis of proteins by directly and permanently binding to 30S ribosomal subunits. For brief durations of treatment, they can be used in conjunction with other antibiotics and are effective against a variety of aerobic gram-positive and aerobic gram-negative pathogens. Okay, now, let's move on and learn about adverse reactions. The two most dangerous side effects are nephrotoxicity and ototoxicity. There may also be neuromuscular blockade. The most frequent side effects of oral versions include nausea, vomiting, and diarrhea. Phlebitis, sterile abscess, and vein irritation are all possible side effects of parenteral medications. Okay, this is important. Let's now learn about contraindications of this medication group. Patients who are hypersensitive to these medications should not use them. When using neuromuscular blockades or in patients with neuromuscular disorders, exercise caution. Use at lower doses in patients with renal impairment. In pregnant women, this medication can cause fetal harm as the safety of this medication for nursing mothers has not been evaluated. However, due to the fetus, neonate and preterm infants having undeveloped renal systems, longer half-life for aminoglycosides is concluded. Dosage adjustments may be necessary for newborns and children. Okay, so now that we have a good idea about how this class of medication works, let's now focus on the commonly used medications of this class, starting with amikacin sulfate. Amikacin sulfate is used to treat serious infections caused by sensitive strains of Pseudomonas aeruginosa, Escherichia coli, Proteus, Klebsiella, or Staphylococcus. The way this medication works specifically is that it inhibits protein synthesis by binding directly to the 30S ribosomal subunit and that it is bactericidal. Side effects are the following. With the central nervous system, side effects are neuromuscular blockade. Eye, ear, nose, and throat system is ototoxicity. Genitourinary system side effects are azotemia, nephrotoxicity, increase in urinary excretion of casts. For the musculoskeletal system, side effects are arthralgia. And lastly, for the respiratory system, side effects are apnea. Okay, excellent. Now let's learn about nursing actions for this medication. The nurse will need to note that ototoxicity may be increased by intravenous loop diuretics like furosemide. Before administering the first dose, collect a specimen for sensitivity and culture testing. Start treatment while you wait for results. Blood should be drawn for peak levels 1 hour after intramuscular injection and 30 to 1 hour after the end of intravenous infusion, for trough levels right before the next dose. Next important intervention is to monitor renal function, including urine output, specific gravity, urinalysis, blood urea nitrogen and creatinine levels, and creatinine clearance. Any indication of deteriorating renal function should be reported. Keep an eye out for superinfection symptoms such as chills, elevated pulse rate, and persistent fever, particularly in the upper respiratory tract. With nursing actions comes patient education. Here are some points to teach the patient. Encourage the patient to continue drinking enough water and advise them to notify the prescriber of any negative effects as soon as possible. Gentamicin sulfate. Gentamicin sulfate is used to treat serious infections caused by sensitive strains of Pseudomonas aeruginosa, Escherichia coli, Proteus, Klebsiella, Serratia, or Staphylococcus. The way this medication works specifically is that it inhibits protein synthesis by binding directly to the 30S ribosomal subunit, bactericidal. Side effects are the following. With the central nervous system, side effects are encephalopathy, seizures, fever, headache, lethargy, confusion, dizziness, numbness, peripheral neuropathy, vertigo, ataxia, tingling. With the cardiovascular system, side effects are hypotension. Eye, ear, nose, and throat system is ototoxicity, tinnitus. Genitourinary system side effects are nephrotoxicity. Hematologic system is agranulocytosis, leukopenia, thrombocytopenia, anemia. Respiratory system is apnea. And lastly, the last possible side effect is anaphylaxis. Okay, excellent. Now let's learn about nursing actions for this medication. Note that ototoxicity may be increased by intravenous loop diuretics like furosemide. Before administering the first dose, collect a specimen for sensitivity and culture testing. Start treatment while you wait for findings. Blood should be drawn for peak levels 1 hour after intramuscular injection and 30 to 1 hour after the end of intravenous infusion. For trough levels, right before the next dose. Monitor renal function, including creatinine clearance, blood urea nitrogen and creatinine levels, urinalysis, urine output, and specific gravity. Any indication of deteriorating renal function should be reported. Also be cautious for superinfection symptoms, such as chills, elevated pulse rate, and persistent fever, particularly in the upper respiratory tract. With nursing actions comes patient education. Here are some points to teach the patient. Tell the patient to report any negative side effects, such as lightheadedness, vertigo, shakiness, ringing in the ears, hearing loss, numbness, tingling, or twitching of the muscles, as soon as possible. Urge the patient to consume a lot of liquids. Advise the patient to refrain from risky activities in the event of negative central nervous system reactions. Tobramycin sulfate. Tobramycin sulfate is used to treat serious infections by sensitive strains of Escherichia coli, Proteus, Klebsiella, Enterobacter, Serratia, Morganella morgani, Staphylococcus aureus, Citrobacter, Pseudomonas, or Providencia. The way this medication works specifically is that it is generally bactericidal. Inhibits protein synthesis by binding directly to the 30S ribosomal subunit. Side effects are the following. With the central nervous system, side effects are seizures, headache, lethargy, confusion, disorientation, fever. For the eye, ear, nose, and throat system is ototoxicity, hoarseness, pharyngitis. Genitourinary system side effects are nephrotoxicity. Hematologic system side effects are leukopenia, thrombocytopenia, agranulocytosis, respiratory bronchospasm. Okay, excellent. Now note that this is within the same class. The nursing actions are the same as the previous medication we just discussed. However, the patient teaching is a little different. With this medication, you will want to caution the patient not to perform hazardous activities if adverse central nervous system reactions occur. Encourage the patient to maintain adequate fluid intake. Teach the patient how to use and maintain a nebulizer. If the patient is using several inhaled therapies, it is suggested that they use this medication last. Also instruct the patient not to use if the inhalation solution is cloudy or contains particles, or if it has been stored at room temperature for longer than 28 days. One quick nursing study tip. Medications that end with mycin or mycin are likely to belong in the aminoglycosides, which are antibiotics. For example, gentamicin, tobramycin, and amikacin. Memorizing this way will help you group medications together, so you don't need to memorize each individual medication. Alright, well, that ends this video. Pharmacology doesn't need to be hard. Just remember what class the medication is under, and most of the signs and symptoms will be similar, as well as nursing actions and patient teaching. Good luck with your studies. Click here for another nursing video.